Over the past 20 years, fertility problems have increased dramatically. At least 25% of couples planning a baby will have trouble conceiving, with 1 in 4 women experiencing a miscarriage, and more couples are turning to fertility treatments to help them have a family. Also, male infertility is said to be on the increase, as sperm counts have been reduced by 53% in the last 50 years. Interestingly, the most common cause of infertility is unexplained, which means that following thorough investigations, doctors can find no specific or identifiable medical problem at the root. But this is where a nutritional approach can come into play. If a couple fails to become pregnant, there is obviously something causing the problem. It is no good labelling infertility unexplained. The answer is to look deeper. Lifestyle factors, nutritional deficiencies, and even emotional elements. So there is a lot you can do to help yourself, whether you're aiming to get pregnant naturally, going through IVF, have experienced miscarriage, or having sperm donation or egg donation. The aim is to help you get pregnant and stay pregnant. Just a reminder to hit subscribe and turn on notifications so that you can follow this channel for more content. Research has shown that making changes in your diet and lifestyle can boost fertility both for you and your partner, and also reduce the risk of miscarriage. Fertility is multifactorial, so it is important to look at every aspect of your health, including your emotions and lifestyle. So thinking about diet, stress, alcohol, weight and smoking can all have an impact on fertility, both for men and women. I have found that if a couple embark upon a fertility boosting diet and lifestyle plan for 3 months before trying for a baby, then their chances of conceiving naturally increases, or it improves the success rate of IVF and reduces the risk of miscarriage. So why 3 months? Couples should think about 3 months when they make changes in their diet, lifestyle, and take certain key nutrients in supplement form. This is especially important if you're over the age of 35, have unexplained infertility, had a number of failed IVFs, or have experienced recurrent miscarriages. 3 months is the recommended period of time for preconception, because it takes approximately that long for the follicles on a woman's ovaries to develop before one is mature enough to release an egg at ovulation. Women are born with their egg store, so although we cannot change your ovarian reserve, we can certainly change the quality of your eggs. And this is really important. By improving the quality of your eggs, it increases your chances of conceiving naturally and also preventing a miscarriage. If you're going for IVF, then this will help the eggs to be as healthy as possible, so as to give you the technique the best chance. With a national average success rate for IVF of just 25%, it is important to do whatever is possible. With men, it also takes at least 3 months for a new batch of sperm cells to mature, ready to be ejaculated. Men produce sperm all their lives, so it is always possible not only to improve the quality, but also the quantity of sperm with lifestyle and nutritional changes. Although it goes without saying that a healthy diet is crucial to a successful pregnancy and a healthy baby, many people are unaware of the fact that diet may affect your ability to conceive. The following are really recommended. Think about having plenty of fruits and vegetables. Have those unrefined carbohydrates, so like whole grains, like brown rice, oats, wholemeal bread. Get organic foods where possible. Think about your omega-3 fats that you would get in oily fish, nuts and seeds. Reduce your intake of saturated fats. Increase your intake of fibre. And think about avoiding additives, preservatives and chemicals such as artificial sweeteners. Reduce sugar, both on its own and hidden in food. And avoid the 3 main fertility busters. We're talking about caffeine, alcohol and smoking, as they've all been linked to an increased risk of infertility in men and women. Having 4 cups of coffee or any caffeinated drinks a day makes it 26% less likely that a woman will conceive, and drinking only 2 cups of coffee a day is associated with a 25% increased risk of miscarriage. And problems with sperm health are connected with increased coffee intake. Alcohol will also make it more difficult to get pregnant, with only just 3 alcoholic drinks or more a week. The same is true for male fertility. And we know that alcohol can lower sperm counts and will also block the body's ability to absorb fertility boosting nutrients like zinc. It can also cause abnormalities in the head of the sperm, which is important for healthy fertilization of the egg. And if a couple has a combination of 4 negative lifestyle factors, we're talking about tea, coffee, smoking and alcohol, it can take a couple 7 times longer to get pregnant. So let's look at the top 3 foods to eat to support your fertility. One of the most important nutrients for fertility is zinc. It's vital for the health and maintenance of the reproductive hormones, both for men and women, and is found in high concentrations in the sperm and is needed to make the outer layer and tail of the sperm. Food sources that are high in zinc include legumes, nuts and seeds. Omega-3 fats can help blood from clotting inappropriately and so can be beneficial to women who have problems with implantation or recurrent miscarriage. For men, semen is rich in these prostaglandins, these hormone-like substances produced from these essential fats, including flax seeds, oily fish and eggs. Fruit and vegetables, these contain good levels of antioxidants, which are important for healthy eggs and sperm, and especially important if a woman's over the age of 35, as antioxidants can help with improving the quality of those eggs. Antioxidants such as beta-carotene, vitamin E, zinc and selenium are high in all the coloured fruits and vegetables. So think about carrots, sweet potatoes, berries, beetroots. You will also get good levels of the B vitamins, including folate, in these foods. So as well as looking at what you eat and drink, there is now a great deal of scientific knowledge about the use of nutritional supplements and their beneficial effects on boosting fertility, either to increase natural conception, improve the success rate of IVF, or reduce the risk of miscarriage. The most important nutrients for fertility are zinc, folic acid in the active methylfolate form, selenium, vitamin E, vitamin C, vitamin D, coenzyme Q10, and those omega-3 fatty acids for the woman and the man, plus 2 amino acids, arginine and carnitine, specifically for boosting male fertility. Zinc is the most widely studied nutrient in terms of fertility, both for men and women, and a zinc deficiency can cause chromosome changes in either the man or woman, leading to reduced fertility and increased risk of miscarriage. Men given a combination of zinc and folic acid in the medical literature showed a 74% increase in total sperm count. Vitamin E has been shown to increase fertility when given to both men and women, and with men, vitamin E helps to increase fertilization rates during ICSI treatments. If a woman over the age of 35 is told that her fertility problems are caused by her age, then it's likely that she could really benefit from taking both vitamins E and C. These antioxidants have been shown to significantly reduce age-related ovulation decline. 2 amino acids, L-arginine and carnitine, particularly important for male fertility. Arginine is essential for healthy sperm production and protects the sperm against oxidative damage. The higher levels of L-carnitine in sperm cells, the higher the sperm count and motility. The omega-3 fatty acids have far-reaching effects for both male and female fertility. Sometimes immune problems may be affecting a woman's ability to get and stay pregnant. The theory is that in order for her body to stay pregnant, her immune system has to quieten down because half the baby's DNA is not hers. Normally, if our body detects something foreign, it aims to reject it and expel it from the body. For some women, their immune systems do not quieten down, and so they can't get or stay pregnant. One of the immune antibodies measured is called antiphospholipid antibodies. These blood clotting antibodies can prevent implantation and can cause recurrent miscarriage by attacking the cells that build the placenta. The medical treatment for this is blood thinners like aspirin and heparin, but research has shown that fish oil given to 22 women with this antiphospholipid antibodies who already had 3 or more miscarriages, went on to have 23 pregnancies, one woman had twins, without a further miscarriage. Omega-3 fatty acids are also important for male fertility because semen is rich in prostaglandins, which are produced from these omega-3 fatty acids. Men with poor sperm quality, abnormal sperm, poor motility or low count have inadequate levels of these beneficial prostaglandins, and by supplementing with omega-3 fish oils, there was a significant increase in sperm count compared to a placebo. Vitamin D helps to balance the immune system, which as we have seen is important in getting and staying pregnant. Vitamin D, like the omega-3 fatty acids, decrease that Th1 autoimmune response, but also to promote the Th2 cells, which help the woman's body to maintain a pregnancy. And we know but by deliberately making mice deficient in vitamin D, they can actually make them infertile. Vitamin D is also important for male fertility, as low levels of this nutrient is associated with low sperm motility and more abnormal forms. Simple lifestyle changes for the men can include avoiding hot baths and tight underpants, as sperm production takes place at 32 degrees centigrade, which is lower than the body temperature at 37 degrees. The testes are on the outside of a man's body to keep them closer, but the closer they get to the body by sitting for long periods when driving, for example, can heat up the sperm and reduce the count. Men using laptops on their laps have been shown to be a problem for sperm health. In order to balance the laptop, men will often close their legs, and this on its own, even without the laptop, raises the temperature of the genitals by over 2 degrees centigrade. But the laptop itself generates heat, and the combination of closing the leg and the heat from the laptop can cause a rise in temperature of nearly up to 3 degrees centigrade. Just a rise of 1 degree centigrade can decrease male fertility by 4 degrees centigrade. Think about this multifactorial approach. There are many things that can affect a couple's ability to conceive, and they are not all medical. To find the cause of fertility problems, it's important to look at every aspect of your health: diet, lifestyle and stress. All the tips apply above, whether you're going for sperm donor, egg donation, natural conception, prevention of miscarriage or IVF. The aim is to help you get pregnant and stay pregnant. And finally, a reminder to hit subscribe and turn on notifications so that you can follow this channel for more content.